Welcome to our presentation on the Oral and Written Language Scales, 2nd edition, also known as the OWLS 2. This presentation is being given by Shelley Smith and Haley Savage. This test was created by Dr. Elizabeth Woolfolk.
This test package comes with the following items: 4 easels, 2 different response forms, 3 scoring manuals, and a comprehensive profile form. This test was published by Western Psychology Services in 2011, and the price of this test is $714.
So for an overview of the OWLS 2, it is a comprehensive language assessment comprised of 4 different scales, including listening comprehension, oral expression, reading comprehension, and written expression. The oral language portion is comprised of listening comprehension and oral expression and is used for individuals ages 3 to 21. The written language portion is comprised of reading comprehension and written expression and is used for individuals ages 5 to 21. Overall, the OWLS measures an individual's receptive and expressive language across a wide age range.
All right. Next, we'll talk about the scales of the OWLS 2. The first scale is the Listening Comprehension Scale, which is for ages 3 to 21 and measures oral language reception, which is the understanding of spoken language. The speech language pathologist will verbally present increasingly difficult words, phrases, and sentences to the client, who then responds by pointing to or stating which of the 4 pictures is correct. Oral expression scale is for ages 3 to 21 and measures oral language expression, which is the use of spoken language. The speech language pathologist will present a verbal prompt along with a picture, and the client must respond orally to the prompt with increasingly difficult language. Reading comprehension scale is for ages 5 to 21, which measures the comprehension of written language. The client is presented with written words, phrases, sentences, or paragraphs and responds by pointing to or stating which of the 4 options is correct. And written expression scale is for ages 5 to 21, which measures the ability to use written forms to convey information. The client is presented with oral and visual prompts and asked to respond in writing. Overall, the test may take approximately 45 minutes to 2 hours.
Okay, now we have different categorizations of things that are measured on the OWLS 2. So for the item analysis, these items are categorized according to linguistic structures that they measure. So first we have lexical semantic, which includes vocabulary, such as nouns, verbs, modifiers, idioms, prefixes, and suffixes. Next we have the syntactic category. This includes grammatical morphemes, function words such as pronouns, prepositions, conjunctions, and determiners. We also have sentence structure, which is based on the complexity, accuracy, and type of sentence structure. The superlinguistic category, which involves non-literal language, double meaning, inferences, verbal reasoning, and humor. The pragmatic category includes the functional and social use of language. The text structure category is combined of reading comprehension and written expression only, and this involves the knowledge and use of other categories to create novel text passages. And lastly, we have the conventions category, which is comprised of written expression only. And this includes letter formation, spelling, punctuation, and capitalization.
Next, we'll talk about score interpretations. Each scale yields its own interpretable score by means of a raw score, confidence interval, age-based and grade-based standard scores, test age and grade equivalents, percentile ranks, and descriptive categories. Raw scores are converted into standard scores. This allows results to be compared with those of standardization sample of typically developing individuals and is used to interpret scaled scores and composite scores. The standard scores represent a standard deviation of 15 with a mean of 100. So for example, if the child scored a 79, he would fall right below just one standard deviation. Age-based standard scores are recommended if you are identifying a learning disability, while grade-based standard scores are recommended if you are using OWLS 2 for curriculum planning. Descriptive ranges translates the numbers into natural language easily understood by parents and other professionals, which include the following descriptive ranges: exceptional, above average, average, below average, and deficient.
Okay, score interpretations continued. These are just some overall guidelines for you to follow and look at when you are looking at the scores that your client presents with. So if all of the scores are low, it may suggest a general disorder influencing all aspects of language. It may also indicate a hearing loss. It may indicate a low intellectual ability, or influences of other languages in the home should be studied as well. If only one scale is low, the written language is usually the last process to emerge and often gets neglected in the classroom. Written skill incorporates the basic knowledge of language required on the other three scales. If the oral and written scales are different, this may suggest failure of the examinee to have mastered relation between oral and written language. This is often the most common that we see. If they know phonics, then other issues may be the cause. If receptive and expressive scales are different, this often occurs with a problem in oral and written task. The problems with writing will not be observed as early as oral. Children learn to write later than they learn to speak.
Next, we'll talk about how composite scores are achieved. Composite scores for oral language, written language, reading comprehension, expressive language, and overall language are achieved by combining the following scales. Oral language composite score is made up of the listening comprehension and oral expression scale. The written language composite score is made up of the reading comprehension and written expression scale. Receptive language comprises the listening comprehension and reading comprehension scale, while expressive language comprises the oral expression and written expression scale. The overall language composite score combines all of these scales together: listening comprehension, oral expression, reading comprehension, and writing expression.
Okay, the second edition of the OWLS came with a new comprehensive profile form. This form can be used to compare each scale with one another to provide information on meaningful differences, which can help us guide intervention planning.
The OWLS 2 contains reliability, validity, sensitivity, and specificity. Reliability includes consistency, stability, and predictability of test scores. Internal reliability measures whether several items that propose to measure the same general construct produce similar scores, while test-retest reliability includes the degree to which results are consistent over time. And inter-rater reliability includes agreement among raters. Next, we'll talk about validity, which is whether or not the test measures what it's supposed to measure. Construct validity is the degree to which a test measures what it claims to measure. Convergent validity includes two measures of constructs that should be related, that are related, and discriminative validity includes whether a test or concept measures whether concept or measurements that are supposed to be related are in fact unrelated. This test is culturally sensitive. The OWLS 2 provides alternative correct responses for African American speakers or other similar dialects. Correct alternative responses are marked with an asterisk on the record form, easel, and manual.
Okay, now we will discuss the characteristics of the standardization sample that was used when creating the OWLS 2. Overall, the sample included 2,123 participants aged 3 to 21 years. The gender sample included portions of male and females that are similar to the U.S. population. For age, it was most heavily concentrated on the younger ages, and age norms included individuals who have not yet entered school or who have entered post-secondary education. The standardization sample included individuals from the following ethnicities: Asian, African American, Hispanic, 2 or more races, and other. Grade norms were smaller than age norms used for this sample. So parent education, which was also used to indicate socioeconomic status, 12.9% were found to have less than a high school diploma, 29.2% were found to have a high school diploma, 21.7% had some college experience, and 36.2% had 4 years of college or more. For the region sample, the individuals in the OWLS 2 represented the East, South, Midwest, and Western U.S. geographic regions.
So, why should you use the OWLS 2? First, to identify strengths and weaknesses and determine the existence of language delays or weaknesses. Also, to help guide eligibility for services in intervention planning. The test also ensures that the examinee is exposed only to age-appropriate items for the child's ability level. And each of the 4 scales assesses 4 linguistic structures, including lexical, semantics, syntax, pragmatics, and superlinguistics. The OWLS 2 is also appropriate in a variety of settings, including schools, hospitals, and clinics. It also provides alternative correct responses for speakers of different dialects, such as African American English speakers, and it is the most comprehensive measurement of language available.
So, what other professionals may be involved in the testing procedure? Professional training and experience in speech and language, child development, psychology, and/or education, or supervision by a professional knowledgeable in the previous areas is required to administer this test. Each professional must have experience and training in administration and interpretation of individual assessments with children.
So, our impressions of the OWLS 2 included that it was fairly easy to learn. It also provided useful charts for comparison of scores. It came with great pictures that could be engaging to the client. It was clear and concise directions, and is also a good starting point to determine where to begin with intervention. One disadvantage that we included here in our PowerPoint is that The OWLS 2 came with multiple materials that are needed for administering the whole test.
Okay, now we are going to provide a short demonstration of the listening comprehension section of the OWLS 2, which can be used for ages 3 to 21. When administering the listening comprehension section, the clinician provides the following directions to the examinee. Okay, I want you to look at all of the pictures on the page. I will say something, then I want you to point to the picture or say the number of the picture that goes with what I said. So then the clinician would say, Sarah joined Jada in a cup of tea. Which picture best shows what happened?
1.
Great job. So as you can see, the client was expected to say the number, which she did so correctly. The skills measured on this page include lexical ambiguity and double meaning. After the clinician has administered this item, testing will continue. We hope that you enjoyed our presentation and find it useful and helpful if you ever decide to use the OWLS 2.